Hello. Thank you for joining us again at Ask Endocrinologists. I am Dr. Hope, and here with me is Dr. Grace.
Hello, everyone. Good to have you all today again.
So, welcome back to Ask Endocrinologists. Today, we're going to be talking about high prolactin levels and what does it mean? How do I know it's high? So, what is a high prolactin level? Uh, Prolactin is a hormone that is made usually in the pituitary gland, and it usually affects women, especially when they're having children. So it causes you to make more milk in the breast, and we normally see it immediately after birth. However, it can present in other circumstances, in abnormal circumstances. So that's what we're going to talk about today. So the high prolactin levels is can lead to something called prolactinemia. So that means high prolactin in the blood, and the most common cause of it is called a prolactinoma, which is a mass in the pituitary gland that makes more prolactin um, and releases it into the blood. So we're going to go on with Grace, and Grace is going to tell you some more about what are the causes of elevated prolactin and the symptoms.
Thank you, Dr. Hope. Whenever this is high in the blood, it usually produces symptoms. And common symptoms that you won't have depend on if it is a tumor, which means the size is it has a mass in the brain, or it's just elevated level of your prolactin in the blood. And the symptoms include headache, unrelenting headache. You've used pain medication and the headache won't go away. There is blurry vision or unable to see side mirror when you're driving, which we call there's loss of peripheral vision, which means you're unable to see when you are driving or your side mirrors, you're bumping into cars, or you just can see things on your side view. These are other signs or symptoms of the level of prolactin. Other thing is your breast start discharging milk, whitish milk from both sides of the breast. It could happen to male, it could happen to female, and then the period can just be irregular or even absent in female. And male can have erectile dysfunction or they can have loss of libido, no interest. When you have these symptoms, it is best to seek your doctor's advice. Let them know what is going on so they can examine you properly and see why you are having these symptoms. And whenever these symptoms occur, we usually do blood work first. After examining you and taking the history, we do blood work. And from the blood work, we check your prolactin level. If your prolactin level is high, then it actually means that those symptoms are correlating with what is ongoing. And if it is very high, because when it is above 200, greater than 200 level of your prolactin, we are already suspecting that it could be from your brain. So that move us to check your brain, doing a brain scan, doing called MRI pituitary gland. That's to be specific for the pituitary gland. And from there, we can examine and confirm the diagnosis and then treat you accordingly. So most of the time, the major diagnosis is by blood and from the symptoms. Only when your level is extremely high or is high above 200, we consider doing imaging workup. So we're going to talk about how do we treat this, because you need to know when you have it, it's not just having the symptoms, what is the management for it? So Dr. Hope is going to talk to us about that. Over to you, Dr. Hope.
Thank you, Dr. Grace, again for that wonderful overview of the diagnosis of and the causes of high prolactin levels. So, how do we treat elevated prolactin levels? So, a prolactin elevation is treated medically with medications. So, as we said, the most common cause is the release of elevated prolactin levels from the pituitary gland, and that's in the brain. So that can be controlled with medications. Two of the medications that we use to treat elevated prolactin levels are bromocriptine and cabergoline. The bromocriptine is usually given once a day, and the cabergoline is given twice a week. So some of the things that your doctor would need to check for if you're on the cabergoline is to check your heart valves, because high doses of cabergoline can actually affect the heart valves in the long term. So they usually would need to do a baseline echocardiogram to look at the heart valves and make sure that they're normal. And yeah, and then we'll just continue with the treatment of the cabergoline or the bromocriptine. So when do you stop treatment? People always want to know, do you actually stop the treatment? Because I don't want to take this for the rest of my life. So there is a point that treatment can be stopped. So people who have the prolactin releasing tumor in the brain, uh, with taking the medications, that mass can actually go away and even disappear. And then the prolactin levels can also normalize. So if you've had a normal prolactin level and no mass lesion in the brain, um, in the pituitary gland for 2 years, then you can actually safely stop the medication. And then your doctor will continue to monitor the prolactin levels to make sure it doesn't come back. So, yeah, so elevated prolactin can be treated with those two medications. After 2 years, it could be stopped if they're normal, if the levels are normal, and if there's no prolactin um, mass in the brain. So that's the treatment for elevated prolactin, and we've reviewed today. So what is elevated prolactin level? How can it be diagnosed? It's diagnosed, as Dr. Grace said, by doing the blood work. And then what are the symptoms? Some of the symptoms are headaches, the loss of the side vision or peripheral vision, as we call it, and some of the symptoms, which include infertility, difficulty, getting pregnant, irregular periods, erectile dysfunction in men, and of course, a milky breast discharge. So, if you have any of those symptoms, that may be something that you need to consider and definitely talk to your doctor. As with all our talks, we definitely recommend these are informational, and we recommend that you actually see an endocrinologist to further evaluate these symptoms. So thank you for joining us. So we ask those of you to that follow us to please subscribe. Please subscribe. We really appreciate your support. We are definitely increasing our subscribers, and we just thank you for that. Um, we want to continue to just provide information to keep you informed and help you to know, because the more you know, the
The
better
better
you
you
are.
are.
So please subscribe and like us, follow us, and we will continue to provide information as endocrinologists to help you with your medical problems. Thank you. Thank you for joining us.
Thank you.